Greeting once again. It's a pleasure to be back. Today, I'm going to talk about pharmacists in non-governmental organizations, that's NGOs and humanitarian settings, with a focus on their role in promoting access to medicines and quality of care in terms of patient safety and related advances. So when we talk about non-governmental organization and humanitarian settings, we know that we have a couple of pharmacists who are interested and have an inclination to venture into these spaces. And as much as they're interested into getting into these spaces, there's a need to actually highlight the role that pharmacists play in these spaces and what are other emerging areas that they could have a role to play in. And that is a critical bit, and that is going to be the focus. So when you talk about NGOs, somebody would be talking of Red Cross, somebody would be talking about WHO and related organizations, AMREF International as one of the other organizations, the Africa CDC as a non-governmental organization, Path International. So there's several other organizations which are not generally the private sector or a government institution, but they're working to deliver access to quality healthcare services, MSF, Médecins Sans Frontières, which is also their management sciences for health, and all these other organizations. And we can even leave that particular domain of the international ones to look at the local available non-governmental organizations. These would include initiatives and small organizations that are working in their local communities to improve access to care. And in these organizations, when you talk about them in that case, these are the ones that would organize medical outreach programs, medical camps in their communities, or organize community education days on health-related activities. So these non-governmental organizations are the kind of organization that would deliver healthcare services to communities, and the services they offer would range from education, that is health communication and education advocacy programs. They offer medical services in terms of the medical outreach programs where we have medical camps, medicines being delivered. And if not only medicines being delivered to patients, it's also the consultative care, ophthalmology care, or dental care. We have medical examination, the medical checkups that will be coordinated by them through the medical outreach programs. Some of them end up having even established medical institutions, standing medical and health programs in the communities, where they would partner with the public hospital around, or even have their own standalone health clinics. And with these health clinics, they're able to deliver medical services to communities where they're needed. And that is where we now have the faith-based institutions. I will talk of one Sagam community hospital that is in Sierra County. So they have interventions and programs that they run to promote access to care. They would be charging a fee for the services, but not as much fee as would be compared to the private sector. And they're also bridging the gap where the government hospitals are not able to reach out to the communities. Then other than that, some of them work in the pharmaceutical system strengthening, and that is a critical bit, for example, in management sciences for health, when you talk about the kind of work they do. We talk about PATH. What interventions are they driving? Africa Resource Center and related organizations. So some of the organizations help logistics. I would mention just that because we are partner with them in our work within the Africa Pharmaceutical Network. The interventions and the programs they're running are designed to help build capacity of pharmacists and pharmaceutical technologists and the pharmaceutical professionals in the industry to be able to offer quality services. And they also help in ensuring the pharmaceutical supply chain system is robust and able to deliver on its mandate, that is ensuring patients and the communities have access to quality medical services that are needed for the intervention in terms of delivering care and promoting their well-being. So when we look at all that scope of medical services that are delivered on healthcare services that are offered by community-based organizations, NGOs, and humanitarian organizations, then we need to be asking ourselves, as a pharmacist, what can I do in such kind of an organization? And I would start of it from the point of what as pharmacists are medicines experts, what role can we play? And when I look at that, the first thing is as medicines expert, when they're offering any health intervention medical program in the communities, there are medicines that will be involved. So we need a pharmacist who will be responsible and coordinating the pharmaceutical supply chain. That is procurement of medicines, distribution of these medicines, and ensuring they're available in the communities where they're supposed to be used, whether it's for a medical outreach, for a standing medical program, and any related. There is need for a qualified supply chain specialist, which would be a pharmacist in this case, based on the pharmaceutical technical background and the pharmaceutical supply chain understanding from now the management component of it. So that is the first bit. When we're looking at these medical outreach programs and also the medical standing programs where they have a health clinic and related, we need pharmaceutical care. And that is where we talk about pharmaceutical therapy and management, where they're supposed to give guidance on whether the recommended or prescribed medications are appropriate and ideal for the patients to use in managing their healthcare condition. That is one bit. Other than that, we need the medicines reconciliation. Probably there is a number of prescriptions have been indicated, and someone has also been using other natural remedies or alternative medicines that are based on traditional healers, which might have interactions with the medicines that are being recommended. Do we have a pharmacist within the care continuum that is able to flag some of these, intervene, and ensure we avoid such kind of harmful events that might affect the lives of the patients? So that is another critical role that we have pharmacists that would be offering. And then within the pharmaceutical therapy aspect, again, from any condition, we have the supporting diagnostic. After diagnostic, we need to look at the management, that is the prescribing, dispensing of medicines, medication follow-up, and actually realizing that a patient A is using this particular set of medication and they're getting improvement in terms of their vitals and they're getting better. If that is not happening, how do we adjust that? So the management of the treatment plan for a particular patient. That is where we look about the role of the pharmacist in pharmaceutical therapy and management. And that is a critical bit other than the pharmaceutical supply chain. So those are the key first areas that we need to look at. How do we play that role? Then another bit when we talk about the role of the pharmacist in humanitarian organizations, when we talk about access to medicine, when we talk about delivering quality care, pharmaceutical care to the individuals, we know there are medicines and healthcare products that are involved. And therefore we need to ensure they are safe and do not cause any undue harm to the patients or the ultimate consumers of these products. Then how do we do this? That is where we now talk about pharmacovigilance and patient safety intervention that can be driven by pharmacists. And when you talk about that, the most critical bit when you talk about pharmacovigilance, everybody thinks of reporting adverse events, reporting side effects of a particular drug. During the COVID-19 pandemic, where we know most of the humanitarian organizations and even NGOs were playing a critical role. Who was reporting adverse events? Who were educating the communities about the probable side effects of even using some of the drugs that were being fronted at any one point in time, starting from the hydroxychloroquine, azithromycin, we're talking about dexamethasone, the steroids, all the drugs that were ever recommended, including now the vaccine that have become the mainstay in terms of response. What are we doing about them? Is there anybody who was educating the masses about the potential side effects and then the mechanisms of reporting these side effects? We need to educate the patient, we need to educate their caregivers and the communities, including the healthcare workers, who they interact with, so that in case I'm injecting a patient with a particular vaccine, and in the next couple of hours, they report that they're feeling maybe, let's say, extreme pain that is beyond the normal that we expected, are we documenting it and reporting? Maybe there's a flare, there's a swelling in the site of injection that is be more than what we expect based on the recommended data that has been already obtained. Are we able to report? Then what are the reporting pathways? Do we have the yellow form, for example, in Pharmacy and Poisons Board Kenya, we have the yellow form that are doing that. If that is not there, then we need to look at how do we report it. Probably a patient will talk to the healthcare provider, go to the health center. The health center will fill the form, then they send it to the county pharmacist. Then the county pharmacy will then collect all these forms and report it to the national government through the Pharmacy and Poisons Board. So that we now look at this data and also know whether the medicines or the vaccines are being used are safe for our people. And if they're not safe, we look at how to make changes to ensure we use alternative medicines or alternative vaccines. That is a pharmacovigilance measure now, that's the education, the reporting mechanism, and even within the kind of humanitarian organization, you're offering medical outreach programs. The first bit is we'd expect a pharmacist to educate the masses that today for this kind of a program that we're launching in this community, it would be about promoting access to diabetic care. That is diabetes medicine, diagnostics, and all the related aspects. So make it clear that we are going to offer the services to the communities to promote access to wellness programs and the healthcare services that they need. But some of the times, the drugs that we offer might not be ideal, and therefore, some of them might have different reactions to these medicines. If such a thing happens, they need to communicate to the NGO, and communicating to the NGO should be through the pharmacovigilance or the patient safety officer that is responsible. That would be a pharmacist in this case. If it goes to the patient safety officer or the pharmacovigilance specialist, then this person should be able to document this and report it to the Pharmacy and Poison Board as the quality expert responsible for safeguarding wellness of the patients in that particular level. And that is a critical bit that we need to look at from the pharmacist interventions. Other than that, we look at it from other than now the pharmacovigilance and the patient safety in terms of the medicine that they're offering, even actually engaging the patients to know that when anything happens, they are responsible for it. Two, at the time of the supply chain, the procurement angle, we need to see that these medicines are the right quality one. And in that right quality, we have to ensure they meet the quality features. There's an identifiable produce of the medicines. The expiry date has not been surpassed. And then there's a clear batch number that is already indicated, and we can already confirm that the medicine is registered in the country within which it's going to be used. If it's in Kenya, we need to confirm through the Pharmacy and Poisons Registry of Medicines to know that this medicine A is registered for use in Kenya, and this is the organization that is responsible. So that if I'm buying medicine from a particular organization to do a medical outreach, at the end of the day, I'm able to reach out to them when there's an adverse event and even let them know that this medicine had this kind of a reaction to our patients. And on this account, we are suggesting you look at doing more research on it and even having a robust pharmacovigilance plan that will ensure we prevent risk for our populations and our public population, so that we have that back and forth communication, the multidimensional communication to safeguard the wellness and the safety of our patients. Then we look to the next thing where we talk about program design, management, and evaluation. Most of these NGO programs are generally project management, because you need to understand what intervention you need to do, the needs assessment, what is the need in the community. For example, when you talk about jiggers, for example, there's a program that I was part of in Muranga. We're looking about jiggers and related. We need to sensitize, identify the need. After identifying the need, we design a program and look at what are the alternatives or mechanisms of us helping eradicate jiggers in that community. Then once we have that in place, now we mobilize resources and coordinate everything to ensure it's available. Who are the healthcare workers we are going to work with? Which community organization do we partner with to give us access to that level? Then once we do that, we now go there to the community and deliver the intervention. Once we are done with delivery, do we do monitoring and evaluation? We attended to 100 children who had jiggers and they were affected. We offered disinfectants. We have offered some other chemicals that were used to be for spraying in the community to reduce the burden in terms of the soil cleanliness, environmental control. Once we do that, after 3 months down the line, do we have a decrease in jiggers, or do we have the same level monitoring and evaluation measures? Ultimately, we need to report and close out. And closing out does not mean we will stop and go away. We can also support now continue our engagement with the community organization that we left there to be able to report to us, even if it's a health center that is government sponsored or the public hospital. Can they report back when there's need, where there's support that we need to offer? Do they have a standing program where they can access disinfectants to continue supporting those who might be still infested with jiggers? So that is the program design, management, evaluation. And as a pharmacist, understanding the scope of the work in the healthcare domain and looking at the project management skill, as I mentioned in one of our series, you can look at it and see, I have a role to play by understanding the needs of the community, designing interventions with them, the human-centeredness. We need to be able to give them what works for them, not what we think should work for them, but what works for them. Then once we are done with that kind of delivery, we monitor and evaluate, close out, we transition it, give it back to the community to ensure it's sustainable, because unless it's sustainable, the positive impact that we're looking at might not happen. And that is also another area that I look at pharmacists playing a critical role, in the sense that I would come to offer medical outreach program, but as I'm doing that, as a pharmacist, the program management skills, I would reach out to the local hospital, whether it's a public or a private, or even a community pharmacy, and have an engagement such that in case we find people who are at risk of having some of the non-communicable diseases, or even who need additional care, we can refer them, the signposting aspect, where they can continue getting quality care and in a sustainable manner. Or maybe some patients have been accessing their medication for non-communicable diseases, and they're not able to access them anymore because probably the program is stopping. Do we link them to care so that they continue accessing their medicine? So that is where the kind of thing that we can look at in terms of pharmacies. Then the health communication and policy advocacy. At the end of the day, everything from disease prevention, health promotion of programs revolve around communication. The implementation of the program is communication. You're working with different people, you need to communicate robustly. Then after the program has been delivered and you feel it's a successful project, you need to now use the best practices that will inform policies to ensure the next phase of project that would be delivered in the community are robust and are addressing the needs of the community. That is now the policy communication, the policy advocacy, and actually getting best practice that can advance the future of our practices. So when we look at all that, we see intervention and the touch points of pharmacists in the NGO sector and the humanitarian settings. And those are the critical bits that I feel we need to look and see. As pharmacists, are we plugging in where we need to plug in? Or are we plugging in partially? Or if not plugging in partially, then what do we need? If plugging in partially, what do we need to do to make ourselves be a critical player in the domain and to make us contribute to advancing access to quality healthcare services and products, and also to improving the patient safety component? And majorly in this, I'm looking at the patient safety component and pharmacovigilance, which I've acknowledged that it's not something that is given priority in terms of the programs that are delivered by NGOs and humanitarian settings and organizations in their spaces. So what would be the next steps for me? The next steps for me is, as a young person, as a pharmacist, wherever you are, please take an active role and see what other additional features can you add into the delivery of care, whichever setting you're working in. That is one. Once you know that, you are able to deliver. Two, build skills in yourself, equip yourself with the skills that are needed. And that is one program that we're very critical about and we are very passionate about as Africa Pharmaceutical Network. We are looking at building capabilities of pharmacists and pharmaceutical workforce in the African continent to ensure that you're able to serve the communities and the patients who are coming to you for help and services, so that we improve the healthcare systems and improve the wellness of our communities as much as we can. So build skills in yourself, identify the need, build the skills that you need to get, and reach out to any other venues that you can get the skills. Finally, for the NGOs and humanitarian settings, you need to incorporate pharmacists and incorporate them not only to run the major highlight, like let's say the low-hanging fruits, helping you procure medicines and all that. Those are good, yes, but the additional aspect, because if you procure medicines and they're not serving patients or they're affecting their wellness in terms of the risks, then it will be of no value. So the quality of your medicines will be linked on how better are they serving the needs of your communities. And that is where we look at the pharmacovigilance measure, the regulatory component in terms of assessing whether the drugs are registered or not, who is responsible for them, or they're coming through the black market. Those are where we'll have the influx of counterfeit, falsified, and fake, or even regulating to ensure that we're having quality medicines into the pipeline in your program, because some of the times we have donor organizations who donate expired or short expiry medicines that might not be safe for the patient that we're serving. And that is where you have your pharmacist ensuring the quality measures are secured, and that is the quality assurance component. So employ pharmacists because you see the value that I can bring on board and you enable them to bring that value. Ultimately, from a professional association perspective, let's drive advocacy and look at streamlining these new streams of work and new processes that can ensure as pharmacists we deliver our value and serve the communities that we need to serve. If we're doing that, we'll be achieving the mission and the mandate of our profession, and I think we'll all be successful in the pursuit of that. And on this account, thank you so much for being part of the programs. I encourage you again to continue subscribing. We have more content lined up for us. Let's engage, let's learn, and let's shape the future of pharmacy practice. In case you have any questions or you have a topic you'd want me to talk about, send me a link, send me an email to africanpharmanetwork@gmail.com. You can check it out on our YouTube channel as well, or you can also check it to the website, Africa Pharmaceutical Network, or even the LinkedIn page. Let's engage, let's learn, let's make the future of pharmacy better. Thank you so much.